We're contacting you because your name was provided to us as possibly having been exposed to a person with COVID-19.
That's Marissa Cohen. She's part of California's effort to contain COVID-19 through interview-based contact tracing.
These are simply disease detectives.
But as case counts surge, some are wondering whether California's efforts are enough.
Do you ever have those moments where you think, my whole life sort of was kind of a preparation for this?
True, Victor, Marissa, and Sonali work for the Los Angeles Department of Public Health. They have more than 40 years combined experience in the Division of HIV and STDs program. In March, they were redeployed to do COVID-19 contact tracing.
When we first started working, because everything was brand new and everybody was just in emergency mode, we were working 14 days straight and 12, 15 hours.
It was kind of just, jump in and start doing it.
It was like, oh my gosh, like, is this how it's going to be?
Because there is a stress around cold calling strangers and talking about personal things.
This has gone beyond anything that I've ever done. The fear or anxiety that people may have when they're on the phone, or even anger.
It's not a completely new thing that's going on. It's just, I think, the first time a lot of people are hearing about it.
In the fight against COVID-19, contact tracing and free confidential testing are key to protecting yourself and the health of those around you.
The patient interview has two parts. First, contact tracers educate patients on how to isolate themselves for 10 days. Then, they ask patients to share the contact information of people they exposed to the virus.
Everyone sort of clams up a little bit when you ask about the names of the people that they may have been in contact with, their phone numbers, their maybe date of birth.
A lot of times it's jogging someone's memory.
Did you maybe see your family? Did you go to a picnic?
They may think of one or two more contacts that they can give me.
After the interview, tracers reach out to the patient's contacts to let them know they've been exposed to COVID-19 and help them quarantine for 14 days.
I've been fortunate to reach so many people, but it's only because that person decided to, pick up the phone when I called.
We try people over 3 days.
But after 3 days, we're supposed to close the case.
California's public health departments have used interview-based contact tracing for decades to contain outbreaks of diseases like TB and meningitis. But COVID-19 presents new challenges.
The magnitude of this disease, like the number of cases, goes far beyond anything that I know that we've dealt with in recent past.
The state gave counties the requirement of having 15 tracers per 100,000 residents. In Los Angeles, that meant onboarding 1,500 tracers.
That's a lot of people to be able to train really quickly, to be able to control quality.
Alina and her team at UCLA helped implement the contact tracing training program in Los Angeles County.
Our training academies model, and then the state's model, is that we're utilizing state, county, and city employees. We just trained librarians, we trained census workers, right? And sort of reorging them to be able to do this contact tracing.
The state spent $8.7 million to develop this training academy and $18.7 million on a data management platform and virtual call center. In addition to these resources, California planned to train 20,000 state employees to do contact tracing and make them available to county health departments. But by July 1st, the state had trained just half that many, and a surge in cases strained counties' tracing capacities.
It's been pretty crazy around here.
We kind of expected a surge would possibly happen. It happened. We've seen a huge influx of new cases each day.
Like the highest day that I remembered was 13. And this week there were multiple days where there were 20 cases assigned to each interviewer every day.
Los Angeles currently has about 2,500 tracers, including 1,000 from the state. The county has about the same number of new COVID cases per day. Tracers are able to reach 70% of these patients within 3 days, but of those 70%, just half are sharing their contacts.
So basically we have, attrition there. So we want to get to 100% of the people, right? And then we want all of those people to give us their contacts because it's very unlikely that people are really just living by themselves or really not around other people.
Most people's response is that they've already been super cautious and they've told everyone that they could possibly need to tell.
Some experts say a digital contact tracing app could help address this problem. In April, Apple and Google released an exposure notification app for digital contact tracing, but by mid-July, no states are using the app.
Obviously, the use of digital apps for contact tracing invokes a lot of privacy and consent concerns, so that it needs to be weighed pretty carefully.
Michelle is a health policy expert at the Stanford Center for Biomedical Ethics.
The most likely outcome of not using them is failure in terms of contact tracing. We're going to have to find other ways to contain the disease. And so far, those other ways have been, don't try to isolate individual cases and contacts, isolate everybody in their homes. And that's really burdensome.
Public health workers are trying to boost contact tracing rates through community education and emphasizing patient confidentiality.
And that we are not going to share any of this data in our databases with any other entities, governmental or otherwise. So having an actual real person explain that to them and talk it through with them, I think is really critical.
Whether California's contact tracing is voluntary or mandatory, manual or digital, its effectiveness is a function of public participation.
This is the time when there is so much to be said about human contact, about human understanding, about human empathy, and about each of us helping one another to be able to do what's right for all of us.